Good afternoon, everyone. Thanks for joining us again today. As usual, I will run through today's statistics first of all. There were 848 new positive cases reported yesterday, which is 9.5% of the total number of tests, and means that the overall number of confirmed cases is now 180,533. Of the new cases, 244 were in Greater Glasgow and Clyde, 167 in Lanarkshire and 111 in Lothian. The remaining cases are across 9 other health board areas. 1,958 people are currently in hospital with COVID, which is 17 more than yesterday, and 143 people are in intensive care. That is the same number as yesterday. And I'm sorry to report that 6 additional deaths have been registered over the past 24 hours of patients who first tested positive in the previous 28 days. As you will recall, though, the figures we report on a Monday are often low because registration offices are largely closed over the weekend. Since the last media update on Friday, 72 new deaths have been recorded, which means that the total number of deaths under the daily measurement is now 6,112. Every single one of those deaths was of an individual who will be missed and is being mourned by families and friends. So yet again today, as I always do, I want to convey my thoughts and condolences to everybody who is mourning a loved one. Now, I'm joined by the Chief Medical Officer, who will shortly help me address questions. Before then, though, let me quickly update on a couple of issues. Firstly, let me just highlight that there will not be a 12:15 media briefing here tomorrow. Instead, I will make a statement to Parliament. That will take place shortly after 2 p.m. tomorrow. And in that, I'll give an update on the latest data and what all of that means for lockdown restrictions. That statement will set out our latest thinking on how much longer the current restrictions might need to continue. As you know, we have already said that they will last until at least the middle of February. But the statement will also provide some more detail on other steps that we are planning to take to help us keep the virus under control, even when we do get to a point when we start to gradually ease the lockdown. The first thing I will say, and I'll go into more detail on this tomorrow, is that the current lockdown is working. I think you can see that in the figures we're reporting every day. It is helping to reduce the number of cases in Scotland, and we should all take encouragement from that. That said, case numbers are still high, too high, much higher than we would want them to be. So we need to get them down further, and then, of course, we need to keep them as low as possible. Obviously, the vaccine is the most important tool we have at our disposal just now, and I'll update a little bit on progress with vaccination towards the end of my remarks. But even with the vaccine programme, there's still more that we need to do. For example, and we covered this in one of the briefings last week, as we suppress the virus more and more within our own borders, we need to do all we can to prevent new cases and especially new strains entering the country. Just as I was preparing for the briefing, I saw news from Surrey today, where door-to-door testing is getting underway because some cases of the South African variant have been identified there in people with no travel history. So the threat of new variants, new strains of this virus remains a real one, and that means we have to be ever more vigilant in trying to stop the virus coming into the country. Of course, we also need to continue, as we have been doing throughout the pandemic, to improve our own surveillance so that we can quickly identify cases, clusters and outbreaks and get them under control as quickly as possible. So tomorrow's statement is also going to cover some of the measures that we will be taking to help us control the virus as we continue to suppress it, and in time, not immediately, but in time, start to gradually ease the lockdown restrictions. So firstly, to reduce the risk of the virus entering the country, as you know, we have already agreed with other countries across the UK to introduce supervised quarantine from some countries. However, as I said last week, in our view, the current UK-wide proposals don't go far enough. So tomorrow we will provide some more information about the extent to which we intend to operate supervised quarantine here in Scotland. We'll also set out some additional measures we're working on to make current travel restrictions more effective than they are already. As well as preventing new cases from entering Scotland, of course, we've got to continue to be able to identify cases within the country, especially in areas where rates of transmission are high, or where, after we have suppressed more than is the case right now, they start to rise again. Now, you'll recall that in December we conducted pilots of large-scale community testing. In selected communities, we offered COVID tests to anybody who wanted one, regardless of whether or not they had symptoms. We've been assessing these pilots over the last few weeks, and at the same time, local authorities have been sending us their proposals for much more extensive use of community testing. In parallel to that, we've been considering whether routine testing can help reduce the risk of outbreaks in certain workplaces and businesses where transmission is a particular risk, food processing plants being an example. So again, we'll set out our latest thinking and plans on all of these issues tomorrow. Now, in addition to that, and most importantly, actually, tomorrow's review will also consider schools and early years provision. And we'll set out our most up-to-date thinking on how and when we might be able to start to resume in-person learning and childcare. Obviously, all of us want to do that just as soon as possible. I'll also tomorrow provide information on some expanded arrangements for testing in those settings as well. And of course, in addition, and lastly, as you might expect, the statement tomorrow will give an update on where we are with the vaccination programme. But I want to, of course, give you an update on that today as well. As of 8:30 this morning, I can report that 575,897 people in Scotland had received their first dose of the vaccine. I'm very pleased to say that now includes 98% of all residents in older care homes. And be clear, that's not just 98% of people in our older care homes being offered the vaccine, that is 98% who have now received the first dose of the vaccine. In addition, 88% of the staff working in older people's care homes have also now had that first dose of vaccine, a really important step in order to help protect the people we know are most vulnerable to this virus. And we saw that, of course, with great distress early in the pandemic, those who are frail and vulnerable in our care homes. However, in addition, I can also report today that 80% of those over the age of 80 living in the community have also now received their first dose of the vaccine, meaning that we are ahead of schedule to complete first doses for that age group by Friday. Obviously, we'll be trying to get to as close to 100% uptake in every group as possible, but 80%, as we get above 80%, we're already getting to the kind of uptake figures that we see routinely or above the kind of figures we see routinely with the flu vaccination programme. So that is good progress to report on over 80s. Vaccination of the over 70 group is now underway as well, and I can say today that already 14% of over 75s have been vaccinated, and this number, with the number for over 70s overall, will accelerate over the course of this week. By the end of this week, everybody aged 70 to 79 and everybody in what we call the extremely clinically vulnerable group, in terms of adults in that group, will have received an invitation letter inviting them to receive their first dose of vaccine, and we are well on track for everyone in these groups to have received the first dose by mid-February as planned. Many people aged 65 to 69 have also already received appointment letters, and more appointment letters for that age group will be going out this week, particularly in Lothian, Grampian and Greater Glasgow and Clyde. And lastly, on vaccination for now, as you might have seen in the media this morning, today marks an important stage in the vaccination programme, with mass centres opening at the Edinburgh International Conference Centre here in the capital and at the P&J Live complex in Aberdeen. The Edinburgh Centre will be able to initially administer 21,000 vaccine doses a week. The Aberdeen Centre will have an initial ability of 6,000. Of course, the mass vaccination centre in Glasgow at the NHS Louisa Jordan is already up and running. Other vaccination centres are opening across Scotland. Many of these in smaller communities will be located in facilities like village halls and sports centres. and by the end of this week, more than 150 of these will be operational in different parts of the country. And of course, that's in addition to the centres and the GP practices that have been administering vaccine for the last few weeks. Now, assuming supplies of the vaccine come through as we expect them to do, this expansion of capacity means that we are confident of meeting all our targets for vaccinating different groups of people. And I want to take the opportunity to pay tribute to and thank all those who are working so hard across the country to get these shots of vaccine into people's arms. Now, last point on vaccine I want to make is just to remind people, particularly those who have already received the first dose or who might be receiving it over the course of the next few days, you must remember that it doesn't start to have a protective effect until we estimate about 2 weeks after you receive it. And at that point, while we know that it will help to protect you from becoming seriously ill if you get COVID, we don't yet know whether it will stop you actually getting COVID or transmitting it to other people. So the reason I'm making these points right now is just to remind you that notwithstanding the good progress we're making in vaccination, that doesn't yet mean we can relax, that even those who get the vaccine will be able to relax restrictions straight away. It continues to be the case that these restrictions are important to suppress the virus to much lower levels than it is at right now. And of course, they only work if everybody sticks with them, including, of course, people who have received or who are about to receive the first shot of the vaccine. So please, everybody, my plea, as usual, is to stick to the lockdown rules. These rules are what I will just quickly recap on before moving on to questions. Of course, the most important ask we're making of everybody right now is stay at home as much as you possibly can. Only leave your home for essential purposes, whether that is caring responsibilities, essential shopping, exercise, work that genuinely can't be done from home. Meeting outdoors, please limit those to one other person from one other household. Work from home whenever you can. Employers, remember you have a legal duty to support people to work from home wherever possible. And if you are out for essential purposes, please remember all of the facts advice. Wear face coverings, for example, if you're doing essential shopping. Avoid places that are busy. Clean your hands and clean surfaces. Use 2 meters distancing if you are meeting with another person outdoors. And self-isolate and get tested if you have symptoms. We are, at this stage, making good progress through lots of hard sacrifice, and we're also making good progress through the vaccination programme. But the virus remains a real threat. It remains at higher levels than we would want it to be, so we've still got work to do, and I'm grateful to everybody for your cooperation with that. So let me leave you with the usual advice today. Please stay at home to help protect the NHS and, of course, save lives. We'll move now straight to questions. And as you can see, the Chief Medical Officer is here to assist me with the questions. And first today, I will go to Louise Hosey from STV.
Yes, good afternoon. First Minister, with the vaccinations of the over 70s starting today, just wondering how many people you expect to have vaccinated across Scotland by the end of the week. And also in terms of vaccine supplies, can you say how much has been allocated to Scotland and is currently being stored at Movianto?
On the first question, we are aiming to do all of the over 70s by the middle of February. So, a big chunk of those will have been done over the course of this week. In terms of, I'll check to see whether what the actual expected breakdown of that is between this week and next week. But remember, the key date is the middle of February to do all of the over 70s. Actually, we would expect many over 65s also to have been vaccinated there. I know there are over 65s who will be starting to get their vaccination this week as well. And I think I know we're on track to meet that, and the progress we've made on the over 80s. Today, 80% of over 80s, the target we'd set was Friday of this week. We are ahead of that schedule. No, I can't tell you that because we've been asked by the UK government not to give figures for the doses that have been allocated to us because they say that is commercially confidential. Notwithstanding that we have agreed for the moment not to publish those figures, UK government ministers continue to brief them to the press, and you know that is a source of some contention. I had a Four Nations call on Saturday, chaired by Michael Gove, where I expressed my frustration, and I want to get to a position where we've got an understanding that either we all agree that for good reasons we don't publish these, or we publish them properly. And if it's going to be the case that these figures are briefed, I would rather we publish them properly and transparently. Let me be clear, that is not about future expected supplies, but about the supplies we have right now and where they are in the supply chain, from the moment they're allocated right through the different stages before they get to somebody putting the needle into somebody's arm. So hopefully we can get to an agreement with the UK government on that over the next few days. But I hope people will realise it's not political in any way to say it's not really fair. It's not so much fairness to government, it's not fair to people to have the Scottish Government asked not to release figures when another government is briefing them out to the press. So we want to get to a sensible and transparent position on that as quickly as possible. Katie Hunter from the BBC.
Thank you. First Minister, given that England has now completed the first dose of vaccinations for care home residents and are ahead of Scotland proportionately for the rest of the population, is there more we could be doing here to speed up the vaccination process? And just for the Chief Medical Officer, from a clinical perspective, how big a challenge is the next phase of the vaccination programme with the over 70s and the extremely clinically vulnerable?
I think it's great news that England has now offered vaccination to everybody in care homes. What I heard this morning, and forgive me, there may be information that I haven't picked up yet, that was offered to everybody in care homes. I've not seen an actual figure that is the equivalent of the 98% that I gave you earlier on of people in care homes, older care homes, actually vaccinated. We've also done 88% of staff in older care homes. I don't know what the position is in England, but we're all trying to do this as quickly as possible, concentrating on the most vulnerable. So I think progress from all of us is to be welcomed. In terms of the over 80s, I think heard the UK Health Secretary, or Health Secretary in England rather, give a figure for over 80s for England of 5 out of 6, which is about 83%. We are now at 80%. I suspect by the end of today we'll be, around about 85% of over 80s. So we've caught up with the over 80s, and of course we are now getting cracking on the over 70s, and the over 75s is already well underway. Over 70s will really start to pick up pace from today. So we're focusing on working through this methodically, starting with the most vulnerable and getting through these population groups as quickly as possible. The new vaccination centres that are coming on site today will help us to accelerate that. And as I said earlier on, we are on track with over 80s. We've, I think, got to a position ahead of what we might have anticipated if I'd been talking about this 10 days ago. And we are on track to have vaccinated everybody in the over 70 group, everybody in the clinically extremely vulnerable group, and a reasonable number of over 65s over the next couple of weeks. Alec Thompson from Channel 4. Oh, sorry, the Chief Medical Officer was asked there about the vaccination programme. My apologies.
So I think you asked, Katie, just about how clinically challenging it is to move on to these groups. And I guess there's really no additional clinical challenge, because providing the vaccine to these age groups is the same no matter what age group that you're in. It's the same process you go through. But as the logistical challenge increases in terms of the numbers that we're actually seeing through these mass vaccination centres, I guess one of the clinical challenges is to make sure that we remain wholly person-centred and in our approach, and so that we can inform people fully about the benefits that they're going to receive when they have this vaccine. Part of that, of course, is to make sure that they understand that after they've had that first vaccine dose, that it doesn't immediately confer protection to them, that they need to make sure that they're continuing to follow all the rules, that they're continuing to stay at home, and that gradually that protection which the vaccine will offer will start to creep in, probably between the 14 and 21 day stage. We're seeing signs that it's a little bit longer in older people. We expect that. We know that that's the case with other vaccines, the flu vaccine in particular. But it's really just making sure that people are well informed when they attend these centres, and they know what to do afterwards. They know what to expect in terms of any potential side effects, such as headache, headache or sore arms and how to deal with that, and just to make sure that they continue at all times to be taking those precautions, to be following the guidance, and to be making sure that they continue to protect both themselves and others afterwards.
Thank you. And now Alec Thompson from Channel 4.
First Minister, good afternoon. I think everybody understands, even in politics, that no system's perfect and we all make mistakes. But the facts are that in many areas, Scotland does lag behind other areas of the UK in terms of vaccine rollout. Just tell us candidly and frankly, what mistakes and shortcomings have you noted thus far with this?
I think it's good to have you join us today, Alex. I think everybody who has been a regular at these briefings, whether they agree with all of my thoughts and explanations, will, I think, concede that I've never tried to shy away from mistakes. We've made mistakes in this pandemic, and I'm not going to go into that. I gave quite a long answer to that question last week. On the vaccination programme, I don't think it would be fair to say we've made mistakes. We have to get it moving as quickly as possible. We have met or are in the process of meeting, actually exceeding all of the targets that we have set. We did at an earlier stage of the programme, and people will say, oh, this is not a factor now, and they're probably right, this is not a factor now, but we are motoring through these other population groups right now. But at an earlier stage of the programme, we did focus with much more, I suppose, singularity of mind on older people in care homes, because they are the most vulnerable. And that does take longer and is more resource intensive. And we now have 98% of those vaccinated, 88% of the staff who work in those older people's care homes. So that's important. We're now in a position where in the over 80s group, I think we're getting close to the same percentage as certainly England. And now we, as of today, although it started over the weekend, over this week, I think you will see a lot of acceleration in the over 70s group, with some people in the over 65s group as well. So I don't think it is fair, it's certainly not fair to those delivering this programme, to say we've made mistakes. We have concentrated on getting a very sustainable system set up that is capable of methodically, group by group, getting through this programme. I've described it, and I'm not the only one to have described, as being in a race between the vaccine and the virus, and I think that is true. That's why we're all trying to get this done as quickly as possible. But I was struck by a comment that was made by the leader of Scotland's GPs a couple of weeks ago, when he said, yeah, it's a race, but it's not just a sprint, it's a kind of fast marathon. There's a long way to go in this programme, and it's really important we do it methodically, sustainably, concentrating on the most vulnerable first, and that's what we have been doing. And I think as we go through this week, we will see further evidence that that is what is happening. I don't know, Gregor, whether you want to add anything from the clinical perspective?
GCVI has been very clear from the beginning, is that there's a prioritisation in terms of the benefit people will receive from this vaccine, and that's why we took the decision to take the very complex vaccination of care home residents for older people. Right at the start of this, it was, as I say, logistically very challenging to do that, I have to say, to use the Pfizer vaccine in that way, but we felt very strongly that it was the right thing to do, to make sure that those who we identified as being the most vulnerable across our society had access to that vaccine as quickly as possible. Now, as I say, that's posed lots of logistical challenges, but we're now able to move on from that. I think it's fabulous news to hear that the rates of vaccination acceptance in that group are just as high as they are, and we'll continue to work through those other groups. The GCVI and the prioritisation framework that they've delivered for us show that these groups, if we target these groups, 99% of those who are most at risk from dying from COVID disease, that we'll be able to vaccinate those as we work through them. And I think that that's the target that we need to make sure that we work through methodically, safely, and reach all these people in as timely fashion as possible.
Just very final comment, which I should have said, which is not really a mistake, but we look at it's not talking about mistake, it's about how we look on an ongoing basis to make sure that we are addressing everything. So one of the things in my mind, looking at today's figures, which I've already taken up with my team this morning, is our rate dipping a little bit on a Sunday? Are enough people being given appointments to maintain that throughput on a Sunday? So, you know, we look critically, literally on a day-to-day basis, to make sure that if there are any areas that we can speed up, then we're taking action to do that. So that's just an example of one of the areas that has been on my mind when I've been looking in detail, as I do every day, at the figures this morning. Peter McMahon from ITV Border.
Good afternoon. Thank you very much, First Minister. First Minister, if you look at the proportion of people who've been vaccinated and compare, say, the northwest of England, the northeast of England to Scotland, then the latest figures show that they are ahead. On the other hand, we've had something in from NHS Dumfries and Galloway recently, and today, and they're saying that they are now rolling out the vaccine to 65 and 69-year-olds, and I'm quoting, begin to deliver vaccinations to this group from today. So is there a problem here in terms of variation? Some good news, obviously, from Dumfries and Galloway there, but perhaps other parts of Scotland lagging behind. And do you know why that is?
All parts of Scotland are. So what we are trying, so at the start, because care homes were so logistically different, and also we had to use the Pfizer vaccine in care homes, whereas AstraZeneca is used much more widely in the community. There was at the start much more of a sequential sense to do this group before we move on to this group. That's not so much the case now. We are continuing to do things in order of clinical priority, but there is more, health boards are looking at grouping different age cohorts together to get through them faster. So you mentioned Dumfries and Galloway, again, without going into sort of anecdotal evidence, I know somebody in my own family in Ayrshire and Arran who's in the 65 to 70 age group who will be vaccinated this week as well. Somebody else in the over 70 will be vaccinated a few days before her. But so most health boards are doing that. Many 65 to 69-year-olds will have had their appointment letter already, and in a number of health boards, those letters will go out this week. So basically, it's to make sure that there's a continuing throughput, that we're not having health boards in the position of finishing 75 to 79s and then putting out the appointments for 70 to 75, or finishing 70 to 75 and then putting out the appointments for 65 to 70s. It's about just making sure that throughput is continuous. So that is how it should be happening, and that is how it will be happening across different health boards. There will be some variation in exactly how health boards are doing this. Partly that will be down to geography and different demographics. So more rural health boards will be doing it slightly differently than urban health boards for obvious reasons. Some of the best progress that has been made so far are in our island health boards. So this is a situation where all health boards are taking the same broad approach, but tailoring that to local geographic circumstances where that is necessary. But we are methodically working through all of these groups, but trying not to do it in such a sequential way that it's slowing the whole thing down.
The only thing I think I would add to that is it's really important that we don't take a stop-start process to this, that we make sure that we've got this rolling programme so that we're constantly looking for the next group to call forward so that we can give them access to these vaccines as quickly as possible. Once we've been able to vaccinate those people who are most at risk, and that's particularly, as I've said before, those age groups that are either older people in care homes or the over 80s, then you start to see the risk between those subsequent age groups begin to blur just a little bit. It's not just as striking. So it's really important, as I say, we don't lose any time and that we're just constantly calling people forward so we get to them as quickly as possible.
Alan Smith from Bauer.
Thank you, First Minister. In addition to the centres opening in Aberdeen and Edinburgh today, we know that the Louisa Jordan has, the capacity to go to 10,000 vaccinations a day. Do you have any sort of indication as to when they may be in a position to do this, or when that might be needed? Secondly, if I may, we've also heard Douglas Ross this morning accusing you of putting your party before the pandemic and challenging you at the same time to a debate on Scotland's future this month. How do you respond to him? And just a quick question for the Chief Medical Officer. Is there any updated information about the presence of the South African variant or any other variants of COVID within Scotland? Thanks.
I'll hand over to Gregor in a second. In terms of the specific schedule for the Louisa Jordan, they will scale up to full capacity as the supplies of vaccine enable them and allow them to do that. I'll see whether they've got a particular date in mind as to when they will get to the 10,000 and come back to you on that. But every centre that we've got just now will be doing as much on a daily basis as they have the supplies to do. Look, I'm not going to spend too much time on a political question, except to say I'm a little bit confused. The leader of the Conservatives appears on one hand to not want me to talk about politics and focus on the pandemic, which is exactly what I have been doing and will continue to do. My only focus right now is on the pandemic. And on the other hand, he's challenging me to debate on politics. You know, I think he might be in danger of making himself look a bit silly. I think I'll leave others to play games on politics. I've got a real job to do, and people can decide themselves whether I'm doing it well or not, but I am absolutely 100% focused on leading this country through a pandemic. That's what I've done since this time last year, and it is what I'm going to continue to do for absolutely as long as necessary. Gregor.
In relation to the South African variant, clearly it's an area that we need to continue to monitor and provide quite close surveillance on for just now. At this moment in time in Scotland, we've only had a very small number of positive cases associated with travel to South Africa that have turned out to be this South African variant, and they've all been managed appropriately, and there's no evidence of any continuing community transmission as a consequence of that. We continue to provide surveillance of any returning travellers who test positive to make sure that we're picking up these data. I'll probably get the latest update from Public Health Scotland later on today in relation to whole genomic sequencing that's been performed in positive cases towards the last week, and we will make any subsequent announcements if there's anything turns up within that data as well. The important thing here is just now is that we've got a very sophisticated system of travel surveillance within the United Kingdom using this genomic sequencing to identify very early any positive cases of either the South African variant or the Brazilian variants, or indeed any other variants of note which we begin to see developing across the globe just now. I think it's inevitable that over time we'll begin to see more of these variants arising, and that's why this whole genomic sequencing that we've all become much more familiar with over the course of the pandemic is a crucial tool in terms of surveillance and protecting ourselves from the possibility of introduction of these new variants. I think it's something that we'll see continuing over time and gradually increasing the number of sequences that we do, particularly for returning travellers from other areas as well. It's an area of profound progress, I would say, that the United Kingdom is able to offer our expertise more broadly to other countries in the world. And at the moment, in terms of the kind of worldwide approach to whole genomic sequencing, currently I think the United Kingdom have identified probably over 50% of the known different viral lineages that are associated with the SARS-CoV-2 virus now.
Thanks. Phil McDonald from Global.
Good to hear about vaccine progress, obviously, but last year the Health Secretary said 1 million Scots would be given a vaccine by the end of January. Can I ask why that target hasn't been met?
We've obviously adapted our estimates based on the flow-through of supply. The targets we have been working to over the last little while, of course, have been to get care homes done, to get over 80s done by the end of this week. We're ahead of that schedule, and now to do over 70s and clinically extremely vulnerable by the middle of February. These are the same targets that nations across the UK are working to, and we are firmly on track to meet them. Tom Eden from PA.
Thank you, First Minister. I just want to pick up on what you said about the sort of drastic drop in the number of vaccines on a Sunday. Last week you were asked about it and you said it could potentially be a lag in reporting, but there doesn't seem to be, according to the figures, any sort of big spike the following day or the day after that. So I was just wondering what answer you had to the questions you're asking about why vaccines drop off on a Sunday.
So it didn't appear to be a lag in data entry last week. Obviously, I don't know whether that will be the case this week. It's certainly, just because it wasn't the case last week, it doesn't mean it is definitely not the case that there's maybe a bit of a data lag. But I'm not, based on last week's experience, I'm not expecting that to be the case. So it looks to me as if, for some reason, we are simply falling off a bit on a Sunday. So I can't tell you any more than that right now in terms of the explanation, but I'm absolutely clear to the team that we need to, if that is an issue, then we obviously need to resolve that, because we need to make sure we're going at a certain pace every single day. So if there's more I want to say on that later in the week, I'm sure I will take the opportunity. Conor Matchett from The Scotsman.
Thank you, First Minister. A couple of questions, if I may. One of the interesting things to come out of the stats is that there's around 248,000, I think, 246,000 health and social care workers who've been vaccinated since the start of the rollout. That's about 15,000 more than were estimated. Wondering whether or not that underestimate of cohort size extends to other JCVI groups, and maybe that the percentages that are being published every day are maybe slightly inflated because of that. I'm not suggesting that's the case, just wondering if that is. And secondly, I know you said, good news today about care home vaccinations, but since the first vaccination, 587 care home deaths have occurred due to COVID-19. 326 of those have been in the last 3 weeks. Were we too late?
We started vaccinating in care homes as soon as we had vaccine supply. I wish we'd been able to do that much sooner, but we didn't have vaccines. We didn't have an approved vaccine to do it. So we've done care homes as quickly as possible, and we've done care homes. I appreciate the comparisons that will be made in other cohorts, but we have done care homes quicker than other parts of the UK, certainly England. So we couldn't have done care homes any more quickly than we have. There is a lag effect, obviously. It doesn't give protection the day you're vaccinated. That's the point we have been making. It takes 2 weeks. That is the estimate for the protection to kick in. So unfortunately, there will continue to be some people after they are vaccinated for a period, will become ill and unfortunately potentially die with COVID. And obviously we don't yet know the extent to which it stops people getting the virus and passing it on. On the first point, it's an interesting point, actually. It's another thing I've been looking in detail this morning. I actually think in the over 80s cohort, the issue may be the opposite. So we have estimated the number of frontline health and care staff, patient-facing frontline health and care staff, which is always going to be a rough estimate. We've actually seen now more than that estimate, as you rightly point out, vaccinated. Now that will be perhaps a mixture of the estimate was a bit on the underside, but also, as we know, for example, happened in the ambulance service. They did their patient-facing group. They had some vaccine left, so did call handlers as well. So there may be people outside that strict definition have been vaccinated for pragmatic reasons to avoid wasting vaccine. The issue in the over 80s, which some health boards have been raising with us, is that our estimate of the cohort actually might be a bit of an overestimate. So their percentage numbers may have been an under report rather than an over report. And that will be an ongoing. We're estimating numbers in each of these cohorts and, refining that as we go along, as the actual appointments go out, will be something that happens on an ongoing basis. But certainly based on the feedback I've had as recently as this morning, if the estimates are out in the over 80s group, it's in the opposite direction. So it would actually have the opposite effect from the one that you outlined there.
Conor, I think the really stark figures you've just outlined there just illustrate why it's been so important to concentrate on care homes residents at this early stage of the vaccination programme. And you'll be aware, of course, that not only does the vaccine take a little while to have its protective effect, and as I say, in older age groups that may be anything up to 21 days to start to show its protective effect, but also that death from COVID-19 is sometimes a process from the point of time from when you become infected through the illness to death can sometimes take several weeks as well. So unfortunately, some of the deaths that we're seeing within that care home population just now may actually have either taken the infections themselves, may have actually started either before vaccination or in the period immediately after vaccination, and it's particularly tragic. I think in those circumstances that people were so close to the vaccination at that point in time. But by making sure that we have prioritised this group of people across our population, those who are most vulnerable, by concentrating in the care homes first and foremost, as soon as that vaccine was available, I think that we stand the greatest opportunity to try to limit any further deaths within that group.
Michael Blackley from the Mail.
Thank you. Good afternoon. If I could just return to what the Health Secretary said to the Scottish Parliament back in the 19th of November. She had talked about the availability of supplies, and she had said that subject to vaccine availability, we will be able to vaccinate around 1 million people by the end of January. The figures you've given today are 576,000. So, in terms of what Jean Freeman actually said, is the truth that you were indeed able to vaccinate 1 million people? You've just failed to do so. Up to the start of last week, there were 1 million doses allocated to Scotland. So why have these been allocated? You've got the supply that you expected, but you haven't actually got these to patients.
No, that's not the case. There is a supply flow from when doses are allocated to getting here. There's a schedule over the weeks of when those doses would have been available. You've just made the point I was making earlier on that this is information that the UK government has asked us not to give publicly, and yet you quote figures at me, presumably that you get from them, which is why we're trying to get to a transparent agreement with them. But in November, when you quote the Health Secretary, back then, just thinking through the dates, we didn't even have an approved vaccine. There were assumptions being made at that point that have had to be, for all countries across the UK, refined on the basis of the actual supplies, not just the totality of those supplies, but the actual phasing of those supplies over the period. And, all countries have been working to the targets of care homes, over 80s and now over 70s, and we are on track to meet those targets. In fact, we've done care homes more quickly than others, and we are ahead of the schedule, the target date we set for over 80s, and now cracking on through the over 70s group as well. So we'll continue to look to pick up pace, look to address issues where we don't think it's going as fast as it needs to. Absolutely candid about all of that, but we're cracking on with this just as quickly as we are able to do. Paul Mallock from the Courier.
Good afternoon, First Minister. We've seen another consecutive Sunday in which the vaccine rollout has dipped. Has the Scottish Government over-relied on overstretched GP practices and the rollout of the mass vaccination centres been too slow? And could this explain why we are lagging behind the rest of the UK?
No, I don't think any of that is the case. On Sundays, I don't know if you were on earlier on, I do think there's an issue I'm looking into in Sundays. Are we dipping a bit on Sundays, and do we need to address that? So I can't go into any more detail about that right now because I'm still getting to the bottom of that myself. And on have we relied too much on GPs versus we thought it was right in terms of the over 80s to have that through familiar, tried and tested GP system as much as possible. As we go into the younger age groups, mass centres or more community centres become a better way in part of doing that. Now, last week I was I can't remember if it was in one of these briefings or in Parliament, there was questions being raised, are we not relying on GPs enough? Why are we not using GPs for the younger age groups and going to mass vaccination? So there will always be different views on whether we should do it one way or the other. We're actually trying to take a sensible, balanced approach where for the older, more vulnerable people, having them vaccinated in their usual GP setting is appropriate. But as we go into the younger, more mobile age groups, getting them through bigger vaccination centres is a better way of doing it. So it's going to be a mixed approach right throughout the vaccination programme. Christine Lavelle from The Sun.
Thank you, First Minister. You were criticised by some for not tweeting, for example, or saying anything on Friday night about the EU's actions in relation to the Irish border. I just wondered, would you condemn the way that the European Commission acted?
Newsflash, I don't spend 24 hours a day on Twitter. In fact, Twitter's a bit of a cesspit sometimes, so I try to focus on productive things more often and actually limit my time on Twitter. Don't assume. I think we all fall foul of this sometimes, that if it's not said on Twitter, it doesn't exist. I think I retweeted Mike Russell on the issue. The Scottish Government had made clear that we thought the position and the action the EU took on Friday was wrong. It was ill-judged, and thankfully they very quickly recognised that themselves and amended it. So don't fall into the trap of thinking just because I'm not tweeting something, I'm not thinking or it doesn't exist. Real life is much bigger and wider than what happens on Twitter. Dan Sanderson from the Daily Telegraph.
Thanks very much, First Minister. In England, according to Simon Stevens, the NHS Chief Exec, they've managed to get through about 3/4 of 75 to 79-year-olds as of yesterday, compared to the 14% figure you said at the start of the briefing. So, you've said yourself that care homes isn't a factor anymore, given England's basically caught up, but less than 10,000 were vaccinated yesterday. So can we just get why is it that Scotland seems to be going so much slower than England? You said in response to Michael, they're cracking on just as quickly as we're able to do. So what is it that England are doing that you're not able to do? And also, if I could just return to the issue of the publication of the figures in terms of supply. It's not just briefings to journalists that we're getting. Alistair Jack was on the telly yesterday quite openly talking about the supply figures. You said last week in the Parliament you were going to publish them regardless of what the UK government says. So I just wonder why you've backtracked on that. Thanks.
I'm not backtracking on anything. I appreciate that I'll always, in the world of the Daily Telegraph, this is not a complaint, it's just an acceptance of reality. I'll always be the bad one. That's just the way it is. But actually, it's not always true. So in terms of, you're right, Alistair Jack gave figures on the television yesterday morning, even although he took part in a Four Nations call on Saturday where it was agreed nobody would do that. So, that's a question you really have to direct to Alistair Jack, where it was agreed that we would actually try to come to a solution here. Now, I just want us all to get on with vaccination, but I'm not having my government briefed against with figures that we're being asked not to share by UK government ministers who are doing it for political reasons. So if that's going to continue, as I said last week, we won't put out future supplies because we're not going to do anything to jeopardise future supplies, but just the kind of information they appear happy to brief or to set on television. What we've got now and where it is in the supply chain. Now, they still are asking us not to do that. So I'm prepared, because I'm a reasonable person, despite what the Daily Telegraph thinks of me, to see if we can come to an agreement, because I don't want these stupid spats. I really don't. We've all got far more to be getting on with right now. But equally, I don't think it's a fair position for the Scottish Government to be put into. On the first point, look, we're working methodically through these groups. This time last week, I was... the question would have been, why are you lagging behind in over 80s? Today we're pretty much the same on over 80s, and I guess probably by, this time next week or thereabouts, that will be true on over 70s as well. So we are getting through this and we are on track to meet all of the targets that we have set. In fact, we are exceeding the targets that we have set.
Just come back on that first point. You say you haven't backtracked. You said last week, regardless of what the UK government says, you're going to just go back and publish the supply figures from next week. So, can you say what did they say to you that made you change your mind?
They had asked if we could come to an agreement, and I'm a reasonable person. Can I just recap here? you know, when we didn't publish these figures, the Daily Telegraph accused me of secrecy. When we did publish them, the Daily Telegraph accused me of putting the supply of the UK vaccines at risk because we'd done it without permission. So we took it away. And now we have the Daily Telegraph. I'm not quite sure what you say I should do. Go ahead. And then when we go ahead, if we do that, despite a request to see if we can come to an agreement, no doubt I'll get criticised. Now, that's fine. That's just, but come on, you know, try, even for the media, occasionally, surely, a little bit of consistency might be appropriate. Tom Martin from the Express.
Thank you. Good afternoon, First Minister. You keep talking about the programme gathering pace, accelerating, and on Friday the Health Secretary promised all 70 to 79-year-olds and clinically vulnerable should have had their appointment letter by the end of last week. This morning I've spoken to a 75-year-old gentleman from Edinburgh who says he and up to 25 of his friends and family aged 75 to 79 have not yet had their call-up. His 74-year-old wife's got her appointment to attend the EICC on Friday. Their acquaintances in this 70 to 74 group, they've all had their appointments within 10 days. And this gentleman said he emailed the Health Secretary on Saturday about this and has not received an acknowledgement. And he's very concerned there's been a complete communication failure and would like to know why he and others in this age group have been kept in the dark about when they'll be getting their appointments.
I don't think anybody's been kept in the dark. Obviously, the gentleman, if you want to pass his details, would be very happy to look into that. I understand everybody's anxious. I said in my opening remarks, everybody in the 70 to 79 and clinically extremely vulnerable will have their appointments by the end of this week, and they will all be vaccinated by the end of the following week. Many will already have had their appointment letters. Many increasing numbers will already be vaccinated as we stand here right now. So, you know, there will always, any system is going to have, you know, glitches where individuals may not get the appointment letter when they should do, and we will always look into that. And in terms of emailing the Health Secretary, I will make sure that the Health Secretary is aware of that. But, you know, also, I'm sure people understand the Health Secretary, as I do, we get large volumes of emails and we answer those as quickly as possible. So we're always happy to look into individual cases, but the focus on getting the whole programme moving and continuing to move quickly is what we are all expending all of our time on. David Ball from the Herald.
First Minister. Last week, the Deputy First Minister said the Scottish Government was considering or looking at requiring medical grade face masks to be worn. Can I ask if that is still under consideration and what role that could play as we come out of the lockdown and more people are mixing? And are there any concerns about the level of protection the current face covering rules offer against the more transmissible variants? And very quickly, on the 98% of elderly care home residents you said that had taken up the vaccine, do you know any of the reasons why some of them haven't taken it up, the 2%?
98% for any cohort is extraordinary. Frankly, if you compare it to the flu vaccine, and the Chief Medical Officer will want to say a word more about this. So if you said to me a few weeks ago we would get to 98% in care homes, I would probably have struggled to believe that was possible. In care homes in particular, why will there be a 2%? You know, we'll continue to try to get that as high. Last week when it was at 95%, I doubted whether we could get it much beyond that. So in any cohort, you will find people, despite our best efforts to persuade, who are just not willing to be vaccinated. But in care homes, particularly with the oldest, frailest populations in care homes, you will have some people who are very close to the end of their life. And it would not be ethical to vaccinate them when they're perhaps days or weeks from dying. And there will be older people in that category who are very unwell, where there are perhaps consent issues. Again, the Chief Medical Officer might want to say a bit more about this, but 98% in any cohort is quite extraordinary for the uptake of any vaccine. And if we get, you know, if we got to anything like that for any of the other cohorts, we'd be absolutely delighted. I mean, I've talked about 80% of over 80s already. I reckon that'll be about 85% over the next 24 hours or so. If you were talking about the flu vaccine, you would be saying, we're not going to get much higher than that. Now, hopefully we will. But these are quite extraordinary uptake levels, and that's a real credit to everybody who's so willing to be vaccinated. I've got nothing else to say on medical grade face masks right now. We keep that and everything else under review, so it continues to be considered, but we haven't taken any decision. We're not imminently about to take a decision to insist on medical grade face masks. And the one thing I would say is that it is really important and does offer protection to wear the kind of face masks and face coverings everybody is wearing right now. So please continue to do that.
David, just I'll come in both your points here just now, but just in terms of that vaccine uptake just now, it's quite extraordinary, really extraordinary. I would never in my wildest hopes could have imagined that we would have 98% of older people's care homes residents who've taken up that vaccine at this stage. I think it's absolutely phenomenal to have that degree of coverage, because when you compare that to other vaccine programmes traditionally, and particularly the flu vaccination programme, it's not even in the same ballpark to that. And of course, there will always be reasons why it's not appropriate to provide vaccination for 100% of people. That can either be through personal choice or it can be through contraindications as well. So, as I say, I think I have to be very clear that 98% is quite extraordinary. On the point about the Class 2 face masks for the general public in public spaces, you'll probably be aware that the ECDC, the European Centre for Communicable Disease, issued a rapid risk assessment on this just towards the end of last week. I think it was potentially Wednesday or Thursday, where they saw that there was no additional benefit in recommending those masks. Clearly, they'll keep the situation under review, and we'll do likewise. But at this moment in time, certainly their evidence seems to suggest that there's no additional benefit which would be conferred by that.
And lastly, Mark McLaughlin from the Times.
First Minister, you said earlier you adjusted your target to vaccinate 1 million people by the end of January because you didn't have the vaccines. Yesterday, Alistair Jacks said you had 981,000 doses by last Monday, with the remainder available to draw down at 24 hours notice. Now, you made your feelings known about revealing that figure, but he said he's got no problem with you confirming already allocated vaccines. So can you confirm that figure? If it's accurate, you had almost 1 million doses a week ago. You set a target for 1 million by the end of January. So you aimed for 1 million and you had 1 million. That's enough to vaccinate everyone over 70. Around 100 people aged 70 to 79 died every week in January. So why are the invitations only going out now to over 70s if you had enough vaccines for them a week ago? And why are the regions of England already accelerating while Scottish progress remains inconsistent? Because it's clearly not a supply issue.
There's a lot of misunderstanding of the supply of vaccines in that question, which I've tried to take on. There is allocation and then there is the flow to the point where we vaccinate. Now, I'm not going to, I've said before that I'm going to try and act honourably and responsibly in all of this. We have been asked not to give supply figures. If we can't come to an arrangement where we either don't or we all give the supply figures, we will put out that information on our own, but I have agreed that we would have further discussions about that, and I'm going to respect that because we're all grown-ups here. I think that we should be trying to do this properly. But to take your figures, assume they are broadly in the ballpark. You multiply that by 10, the UK would have 10 times that. They haven't done the number of vaccines that would sit with that supply figure, because for them as well, there is the point of allocation through to the ordering and flowing into the system. So we have set targets based on the flow of supply, and we are exceeding those targets, on track to meet the next ones we've set, and we'll continue to accelerate the programme as much as we can. That concludes the questions for now. If I can thank all of the journalists for joining us today, thank Gregor for his help with the answers, thank Jill for the BSL interpretation, and thank all of you for joining us. I will, as I said earlier on, give the update on the fortnightly review in Parliament tomorrow, shortly after 2 p.m, I think round about 2:20. Please join if you can. In summary, we're making good progress, both in suppressing the virus and on vaccination, but we've got more work to do on both. So I'll set out our latest thinking and the steps we will take tomorrow. But in the meantime, please continue to do everything that you are doing to help us suppress the virus, stay at home in order that we can protect the NHS and save lives. When you're called for a vaccine, please go and get that vaccine. Please remember that it doesn't kick in immediately. It takes a couple of weeks, and even then, we don't know the effect it has on transmission. So continue to be cautious, even if you are one of the people across the country now that has had or is soon to get the first dose of the vaccine. Thanks for joining us today, and I will see you from the Scottish Parliament tomorrow. Let me just say right now that I will see you from the Scottish Parliament again on Wednesday when there is the weekly session of First Minister's Questions at 12:30, 12:20, 12:30, when I'll give the daily update, and I'll be back here to do an update at 12:15 on Thursday. But thanks for joining us now.